Hello, everyone. We are ready to start, I think, because it's 6 o'clock. I'm Shannon Nosbisch with Effingham Area Alzheimer's Awareness, and we welcome everyone here. Jackie Witges is a certified care manager, recently retired. Just a month ago, she retired. So we welcome her and thank her for helping us out tonight. I wanted to make sure that you knew that if you have questions during the presentation, go to the bottom of your screen. In the middle, there's a chat button. Just push on that, and then you can type out your question and send that in, and we'll get that so Jackie can answer that. If there's any other questions, at the end, you'll have an opportunity to ask questions. So just type your questions whenever you want to. So I think, Jackie, we'll go ahead and get started, and then we'll get going here.
Okay, so welcome everybody. I know this is an important topic, otherwise you wouldn't be sitting here listening to me on this beautiful spring evening. We have a lot of material to cover tonight, so I'm going to jump right in and give you the basics on a lot of different ways. First, we're going to explain the different types of long-term care and then give you some options for paying for them. I always like to say, don't kill the messenger on this, because I think we all want that magic button and that I have, some secret on how we can pay for this big cost for caring for our loved ones. I don't have that magic potion or that easy button for you. And what I hope to give you tonight is that basic information so that you can continue on and do a little more research and hook up with some more resources for you. So again, I hope everybody can see my screen, and we're just going to go right to it. Well, there we go. So hopefully what you're going to understand by the end of the evening is the importance of selecting a venue of care that matches the needs of your loved one. And I always stress that we are all individual people, so we all have different values, different wishes. We also have different care needs. So just because somewhere was really, really good for Uncle Joe does not mean that it's going to be the exact same place that might be good for Aunt Betty. So always look for their values and what their specific needs are. The other thing that we're going to talk about is understand the different levels of care and the different care options. And then, of course, have a basic knowledge of ways to finance the ongoing cost of long-term care services. So know what it is you're looking for. And I always say we need to have a plan, even though the need may not be urgent, may not be today. If we ourselves are aging, if we have aging parents, aging grandparents, aging siblings, or siblings with disabilities, planning in a crisis is not ideal. So I always say we need to have a plan, maybe with option A and option B. Know that plans can be changed at any time, but typically, at least even a basic plan is much better than trying to jump into this with no idea or no plan whatsoever. Again, I want to stress, one size does not fit all. Just because it was good for one person doesn't mean that it's good for another person. Again, their values are different and their needs are different. So that's really your starting point. You need to start a list of, what kinds of things does my loved one need help with? Everything from, go through their day. What do they need help with when they first got out of bed? What do they need through all their meal times? What do they need when they're bathing, when they're dressing, when they're taking their medications, when they're getting in and out of a car? Can they speak for themselves? Can they hear well? Can they see well? So that's your, might be a big list. And sometimes what we forget is you typically, when we are caring for someone, unless it's an emergent issue, we start taking on those care tasks one by one, little by little. And we don't even realize, unless you are journaling that, what all you're doing for your loved one. And what happens then if something happens to you and you're out of the picture and somebody else has to start from scratch, and they're overwhelmed because they have no idea. So again, start at the beginning of the day. What kind of help are you providing? What kind of help do they need? And again, remember what is important to them. What are their values? What are their wishes? And how can we find care that link the two things together? The care that they need and the care that they want or that they will accept. And remember that sometimes we have to do it in steps. So talk about person-centered care. Picking out a care venue, care services for someone you love is a lot of times one of the most important decisions you will ever make. Again, realize that as care needs change, additional decisions may need to be made. And remember, you can always change your mind. If you decide on one thing and it's not working, don't feel like you're stuck there. Be cautious of what kind of contract you may sign with someone, because you may not like it. And, if you buy a new car and it's not good, you're going to take it back and you're going to keep taking it back till all the little kinks are worked out. So kind of think of it like that. Just because you've made this decision does not mean it's going to be the final decision that you make. The primary goal when you make these decisions should be the quality of care that maximizes the quality of life for your loved one. And care decisions should mirror their beliefs and their values. Hopefully your wishes are in line with theirs, and that'll help you make those decisions. Hopefully you've had those conversations with them, because if you don't know, if we don't tell the ones that we've lined up to be our decision makers what our wishes are, boy, are we putting a big burden on them. So sometimes those conversations are hard to have, but you need to have them. And of course, the pandemic. Boy, oh boy, did that really throw a curveball into what we've got going on. I'm going to be talking about questions that you should ask different care providers, and the pandemic has added to that list. So we'll talk about that. I always say don't buy a Canon if a BB will do. There's a lot of things that can happen between being home and being independent and needing to be in a long-term nursing home setting. So I'm going to talk about the different levels of care and what you can expect. So is it help at home? Again, when you're looking at after you've made that list of all the different care needs that someone has, can they still be at home with some help? And of course, we're going to talk about the cost of that a little bit later. You know that we have home delivered meals now. And don't just line up home delivered meals if they're never going to eat them. So, that's another big thing that we need to look at. So if they're saying they don't like the home delivered meals, can we work with getting, a meal chain going? Do you have time? Can you call on other family members, church members, to make meals that can be put, in the freezer and microwaved, or, easily made up? Personal emergency response systems, these are the help buttons. We have a lot of folks who say, well, I don't need one of those because I have a cell phone. Well, if they fall, one of the first things that's going to fly out of their hand is going to be their cell phone. If they fall in the shower, they probably don't have their cell phone on them. If they forget to take their cell phone with them when they get out of bed and they fall in the kitchen, that cell phone is not going to help them. So there's lots of different options for those. For low income people, there are even some programs that will pay for those systems with no cost to the individual. The VA, if someone, your loved one or someone is already enrolled and receiving any services through the VA, they will provide those emergency response systems. If they need help with medication administration, of course, a lot of our pharmacies now will do the pre-filled pill boxes and even the little packs, you know, for morning, noon, supper time, and bedtime. So that may help, but again, they have to be able to manipulate those things, you know, open the pill boxes, open the packages, and then remember to take them. So just because those pills are in those little packages and boxes doesn't mean that they're going to be taken if the person can't remember to do so. Do they just need assistance with shopping and housekeeping and errands? And of course, now you can order. I do this for my sister and my mom. I can help them with shopping online and have a lot of things shipped to them. You know, even Aldi, they'll, you know, deliver to your home. So if they can't actually manage going through a store, and of course, again, with the pandemic, do you want them in a store? There are all different kinds of options there. Here in Effingham, Save a Lot and Kirby IGA will deliver groceries. We have public transportation now in almost all of our rural areas. There are some caveats, again, with the pandemic with that. How do we pay for these things? A lot of individuals, these things are private pay. For low income, we have community care services, which you can link up with through the senior center, so they will do an evaluation. If you are extremely low income, they will provide a lot of these services for you. If not, you may be put on like a fee scale based on your income and assets. So your local senior centers have a community care program care coordinators that will come out and evaluate your needs as well as your income and see what you qualify for. Adult daycare, we do have some adult daycare services provided. So maybe, you know, the person just can't be alone during the day because you have to work. So when we talk about adult daycare, we don't just need to think about freestanding adult daycare centers, but a lot of the assisted livings, memory care, and nursing homes do adult daycare and respite care. If you say, and we'll talk about respite care a little bit more here in a bit, but you know, say maybe you just need a break for a weekend, or you need to go away for a family vacation or a wedding or something that you just need a few days or maybe a week-long respite. Those are options as well that you need to look into. So again, this next slide just kind of breaks down what we talk about as supervision, you know, housekeeping, meals, medication reminders, bill paying, and the emergency help buttons. Those are the kinds of things that we talk about under supervision. Moderate assistance, again, we're looking at more and more hands-on care, toileting, bathing, dressing, and really, really handling their financial oversight. When we look at the more total care, it's when people have difficulty communicating, they're unable to feed themselves, they're unable to control their bladder, and their designated decision makers really need to step in and handle health and financial matters for them. So again, if you're looking at your list of needs, where are we at on this continuum? Help at home. I think we all want to stay in our home. Don't blame you, you know, but things that we need to be aware of. The safest and most effective option is going through a licensed, reputable agency that employs the homemakers and the caregivers. Be upfront, you're going to pay probably twice as much for those individuals as you are finding someone that says that they will do it privately for you. So what do you need? You know, well, why wouldn't I do that? Why wouldn't I go with someone that I can get for a lot less? These are some questions that you need to ask. What training have they had? Do they know how to safely transfer someone? Do they know CPR? What happens do they need to help your loved one eat? Do they need to help them with their meals? Do they know the Heimlich maneuver? What if your loved one chokes? Do they transport them? Will they take them to the doctor? There's a big liability if they drive your vehicle. Some private caregivers will say, yes, we can transport, but I have to drive your car. So that puts, that's a big liability. If they're transporting them in their car, that's another way to look at the liability. Infection control and personal protective equipment, that's always been very, very important to me as a nurse. Do they know and follow the basics of infection control? And now with, of course, COVID-19 and the pandemic, that really ups the game on that. And where have they been? Do they care for more than one person? Where are they protecting themselves? Are they living with people who also follow all of the rules now for being careful during the pandemic? So lots and lots of questions there. Be aware that hiring privately makes you the employer. You are the employer. So that means that, all the taxes, tax forms, your records for auditing need to be very meticulous. Health screenings, background checks. You are an employer, workman's comp. What if they get hurt while they are in your employ? Do you have liability insurance? Are they competent? Are you allowing them meal breaks and rest breaks? Do they just want to come into your house and they'll say they'll stay for 24, 48 hours and you just pay them cash? That's a lot of liability for you as an employer. There have been ugly unemployment issues, wrongful dismissal suits, suits by individual caregivers who are not employed by that agency and you are the employer. They get hurt on your property, but they say, I have my own health insurance. Well, it's not the individual that's going to sue you. It's going to be their health insurance when they find out that they're paying for an injury that happened on your property. So again, when you think, I can hire this person and I know they're really, really good because they've taken care of other people that we know and they come highly recommended. If they are just going to be sitting with your loved one and providing companionship, that's a whole different story. Once they start doing more hands-on care for your loved one, your liability really, really, really increases. So now we're going to talk about if we can't stay at home, where do we go from there? Again, we talked a little bit about adult daycare. And when we think about adult daycare, again, don't think of just freestanding adult daycares. Think of assisted living, memory care, and nursing home that will do adult daycare within those facilities. Assisted living. So what an assisted living is, and remember, the level of care that these facilities can provide is guided by the level of their licensure. So assisted living is the individuals can do pretty well on their own with minimal assistance, but it's too much for them to live at home alone, care for a home. They get their meals here, they get their laundry done, they get housekeeping done, lots and lots of socialization. Of course, again, with the pandemic, we've had some, things are really opening up again now that people have been vaccinated, but assisted livings typically are very social hubs for people who are lonely, people who used to go out and do a lot of things, but they just can't get around like they used to. Assisted livings are wonderful, wonderful places. They have care staff there. Of course, they have the emergency call buttons, and they wear them around their neck, and they have them in their bathrooms. They're private little apartments. Again, based on what you're looking at, some of them have little kitchenettes, some are more studio. And again, the more bells and whistles they have, more as the cost is going to be a little bit higher. But assisted livings also can help with medication administration. They typically have nurses, not necessarily around the clock, but on duty most days, at least for limited hours, and then have some nursing staff on call that can help. Supported living can help or can occur in an assisted living. We have only a few options for supportive living in our area. And the difference between a supportive living is that there is Medicaid assistance for the cost of care in a supportive living situation. Then we have memory care and dementia care. Memory care homes are licensed pretty much as assisted living, except if they are licensed with the dementia care component. That allows them to provide more hands-on care, such as the bathing, the dressing, the toileting, the feeding, assistance at meals. So still their physical functionality needs to be such that they don't require the assistance of a mechanical lift to transfer from like a bed to a chair or in and out of the bed or off the toilet. The only way that a memory care, dementia care home can have a mechanical lift in their building is if someone is on hospice. Memory care homes, most of them in our area, have nursing care, if not 24-hour, 24/7. They have them 12 to 15 hours a day with a nurse on call. And then, of course, we go into the traditional nursing home. And there are levels of care there with skilled rehab, which is covered by Medicare. We'll talk about that in a minute. Or long-term, more custodial care, which Medicare does not cover on the long haul for that. So we'll talk about some options. So again, understand that the level of care is guided by the level of their licensure. Again, I'm going to caution you on unlicensed providers like unlicensed adult daycares, unlicensed agencies, or unlicensed persons that provide care in your home, because who's providing oversight to them? If they're not licensed, there's no oversight. There's also a few shelter care situations available that kind of are similar to assisted living, but they are unlicensed. And so, again, they do not have any type of oversight. They have no regulatory body making sure that the caregivers they have in those situations are trained, and that opens up a whole lot of issues. Again, consider respite care. So if you're not needing 24/7 care for someone, consider respite care in the assisted livings. The memory cares are the nursing homes. So how do we pick? Do your due diligence. In-person site visits are the very best. Scheduled, I always say unscheduled is better than scheduled. Walk in unannounced so that you see how things are really going on. Again, with the pandemic, we've got some issues with that. So you're probably going to have to, at this point, schedule your visits, and then they're going to screen you And you will not be able to go into all the sites within the facilities that you normally would have prior to the pandemic, but hopefully we'll get there soon. If you can, talk with the residents and talk with their family members and talk with more than one family. You know, how is it? How was it before the pandemic? How have things changed now with all the new regulations? You, that's who's going to tell you. And the best referrals are going to come from family members who have a loved one in the facility that you're looking at. Again, use your eyes, ears, and nose as much as you can. Ask if you can taste a meal, even if it's a scheduled visit during this pandemic. Ask if you can taste a meal. You want to see what the meals are like. Let's face it, for some of our loved ones, when they're needing this level of care, one of the few real joys that they have is a good meal. And if the meals are not good, that's really going to be a downer for them. It's going to add to their loneliness. It's going to add to their depression. Can you bring meals in? You know, not maybe every day, but can you bring meals in a couple times a week for them? Those are all questions that you can ask. Talk with staff members. Longevity of employees is key. Unfortunately, with the pandemic and with some of the funds that are available to people for not working, some of our facilities are having a really, really hard time with staffing. So that needs to be a big question. You know, how is your staffing level? Are they your own employees or are they agency employees? Happy employees equal happy work, equal happy residents. So again, this whole pandemic has shifted a lot of things. So, you know, I hear of people say, you know, I loved it. Everything was so good. And then the pandemic hit. And because of, you know, the staff members are all dealing with issues, you know, their own issues and, you know, maybe caring for small children and they can't come to work. And now they've, you know, the staff that we just loved and we're so good, they're not there anymore. So ask lots and lots and lots of questions. Again, more questions since the pandemic. So what is the mitigation plan that they have in place? What happens if they have an outbreak of COVID within their staff? Who's going to be there? You know, what plan? Do they have an agency in place that's going to come in and take the place of the staff that can't be there? You know, what's the plan? We hope that by now there is not a place, you know, flying by the seat of their pants. They should all have a really good mitigation plan in place and ask what it is. Have they had training and are they following it? CMS mandated CDC training for all facilities at every level. Home health, they all should have, it's a 3-hour mandated training. Have they had it and are they following it? Vaccines, you know, are the vaccines available? Is everybody getting a vaccine? As a facility, if my loved one's going to live in your facility, will they help them, you know, where will they facilitate for them to get the vaccine? You know, are we going to have boosters if they've been vaccinated, but now they're saying we might possibly have to have boosters? What's the plan for that? Here's a big one. Is there an additional charge for the personal protective equipment for the staff now through the pandemic? And are they charging you for that? You know, unfortunately, long-term care facilities, assisted livings, memory care homes were the last to be provided PPE by the government. And we saw what was happening in our long-term care facilities. A lot of that has changed and they've uprighted the ship. The good facilities, you know, had, I shouldn't say good facilities, the facilities that were planning ahead for any type of an emergency had PPE. Those, for whatever reason, didn't have that in their emergency preparedness plan. We saw things on TV. We saw staff going without PPE. We saw staff wearing garbage bags because they didn't have gowns. So ask the questions. Ask the questions. What's the isolation plan? What if another resident in a facility, is positive? What are the isolation plans, and how long will my loved one have to be isolated? What are the visitor requirements? Things had really opened up. Most facilities, again, they're limiting the time that you can visit with your loved one, the area you can visit in. You have to be screened. You have to schedule the visits. And a lot of that seems, it's bothersome. But if that's what we need to do to keep everybody safe, that's what we need to do. And again, there's another don't kill the messenger story that I'm going to give you. These facilities, this is mandated. Even if it wasn't mandated, their plan is to keep everybody safe. So even though it's a hassle and maybe you can't visit it at the exact same time that you used to visit, it's different and it's a challenge for everyone. So let's give everybody some grace through this time.
Okay,
So
Jackie,
how do I know? Yes.
we have a question.
Okay.
It's turnover is huge in the skilled nursing facilities and the rehab centers. What's a good way to judge this when speaking with employees?
Come right out and ask them. Come right out and ask them, how much overtime are you working? Are you getting days off? Do you get breaks? And just come right out and ask them. Just come right out and ask them. And don't just ask the person that's giving you the tour. Ask them, look at them, look at them, do the staff, are they running? Are they running? I was in a facility a couple of weeks ago, and one of the CNAs, just sweet as could be, she literally had the back of her t-shirt was wet with sweat, and she was just going so fast. And I just, my heart just went out to her. She wanted to get to all of her residents and do all of her things, but she was short-staffed. And you just got to come right out and ask and look at them. Like I said, use your eyes and ears, see what you see, hear what you hear, and ask the questions. For Medicare certified home health and nursing homes, I've listed here. And what I plan to do in the next couple of days is to put together a sheet with all these different websites. And as I talk about different agencies with their contact numbers, I will put that together in a spreadsheet format and get that out to Shannon and to the folks at the library, and they can email that out to anybody that wants it. Medicare certified home health agencies, if you're picking a home health to come in and provide care after a hospitalization with, wounds, if it's a nurse coming in, if it's physical or occupational or speech therapy, and you're not sure, again, talk to folks in your neighborhood, talk to folks in your church, who have you had come in for home health, who was good. Also, this is a website that you can go on to. You can pick up to 3 different home health agencies at a time and compare on different factors. They've got things like wound care. So if your loved one is needing a nurse to come in and take care of a wound, you can look and see, when they have patients that have wounds, do they get better or do they not? And it may be different if your loved one is there because they've had a stroke or a joint replacement and they're just needing physical therapy. So look and see, did that person get better at walking? Did they get better at bathing? Did they, have any new issues while they were under care of that home care agency? Nursing homes, I've got a whole list of different ways that you can check on nursing homes. Similar to the home health, there is a Medicare.gov compare just for nursing homes. With all nursing homes in Illinois Department of Public Health posts on this website detailed information of all of their surveys. So for nursing homes, they are surveyed by Illinois Department of Public Health at least once a year, and more often if there are complaints. So you can go on and you can see what kind of issues they've been tagged for, or that they've had deficiencies in. Some really, really good tools here if you're nursing, if you're kind of savvy on the internet. And if you're not, ask your doctor, ask people, like I said, people that you know, people in your neighborhood, people in your family, people in your church, or your loved one's church, or family members if they're from outside of the area. But these websites, these internet sites, are really, really good at pulling up some comparative data for you. So when again, more questions to ask, and don't assume when you are checking into a facility what's included in that monthly or daily fee. You know, do they provide the incontinence products and the personal care items, or is that something you need to provide in addition? Or if they do provide them, is there a cost? Who administers the medications? In a licensed nursing home, it's going to be a licensed nurse. It may be an LPN or an RN, but it's going to be a licensed nurse. If most of the memory care homes, again, medications are administered by a licensed nurse. Assisted livings have medication reminders. Those are not nurses typically. Those are CNAs or maybe resident assistants that are there to remind your loved one to take their medications. As care needs increase, if they're in a nursing home, there will be a nurse on duty 24/7. If it's assisted living, probably not at night. There will be a nurse on call. And again, there is a difference between the different memory cares in our area. Some have nurses on duty 24/7 and some do not. Again, here we go back to staffing ratio. What's the staffing ratio? How many residents, how many people do each caregiver, how many are they responsible for in their shift? And that varies widely. And that is probably one of the most important questions that you should ask. Again, are phone, cable, TV, or internet, are they included in the fees? And if they have TV and internet, what channels do they get? My father-in-law was in an awesome continuous care community. We lost him earlier this year. He had long time Parkinson's, and the care he got was awesome. But by golly, they changed cable providers, and he lost the St. Louis Cardinals, and it was not a good situation. So again, if that's the only joy they have and they lose it, it can be a big thing. So when you start asking questions, and if there's extra charge for this and extra charge for that, it can easily impact that rate by 25% or more. So, yep. Got another question?
We have another question. What's a good staffing ratio?
Well, it depends how much care the person needs. So, if they're in assisted living, and they don't need very much care, they just need oversight, supervision, making sure they get down to meals, making sure that there's somebody there making rounds at night in case somebody has a fall. You can go 1 to 20 maybe. That's if they don't have to assist with bathing or dressing or toileting. If you've got memory issues, that ratio is going to really, really shift. And some of the best ratios in a memory care, dementia care, is going to be about 1 to 6 during the day. maybe 1 to 8 or 10 at night. Nursing home, day shift is going to be different because nursing home during the day has a lot of different people putting eyes and ears. You know, they have their rehab people, they have their activities people, they have social services people, they have their administrative and department heads. But for people that are needing care with almost everything they do, and when you look on some of these comparative sites, they tell you how many minutes of one-on-one care the person gets. So, do I have a magic number for that? I am going to tell you there's very few facilities right now that make me very happy with their staffing ratio. Think about how long it takes to give somebody a good bath or shower, help them on and off the toilet, get them dressed, spend a little bit of personal time with them. How many people do you think you can do that for in a shift? And if I'm only saying that if they only say, well, our staff, our residents get about, 10 to 20 minutes of one-on-one care per day, that shouldn't make you very happy. So that again there's no exact science to that. Typically nursing homes do put their residents in an area or a wing based on how much care they really need. So they will have those who need more supervision type care on one wing, and the staffing is going to be less. And those people that need a lot of care with a lot of things that go on throughout the day are going to be in another area, and those areas are going to be staffed with more staff to resident ratio. You got to be comfortable with it. And so again, there's no magic number, but again, it depends on how much care they need. And if I have a person that needs almost total care and they're going to tell me they're going to get 20 minutes in a 24-hour period of one-on-one care, that's not enough. So ask it maybe in that way. How many minutes of care, one-on-one care, do they get every day? Okay. So we've talked about things to consider and things to ask when we're trying to figure out what type of care is best. So that's a big part. Again, make that list, figure out what the needs are, and figure out what kind of care each of those facilities can offer you. Okay, ask those questions. So once I've figured that out, how am I going to pay for it? This is the big reason I think a lot of us are here this evening. The majority of care that you are going to have in the future for your loved one, a lot of it may come from private funds. You are going to write that check every month. They're going to tell you how much it costs, and you're going to write that check. Well, what if those funds aren't there? Those funds are limited. Then what do I do? So the first thing we're going to talk about is long-term care insurance. And the long-term care insurance industry has really started to change. I don't sell long-term care insurance, but I'm going to tell you things that you need to ask when you're looking at long-term care insurance, and if it's something that's even feasible for you. Number one, understand your policy. Just like any other insurance that you may have, which I think we're all insurance poor, what does it really pay for? Does it pay, the more it pays for, the higher the premium is going to be. So does it pay for dementia care or assisted living? Because again, those are licensed as assisted living. Some of the older long-term care policies will only pay for nursing home care. because in reality, those policies were in place before assisted living and memory care were even really in existence. So with some of those older policies that say they will only cover for nursing home care, you can appeal that sometimes. And we have been successful in appealing some of that because we can prove that the care being provided, especially in the memory care homes where there's a lot more hands-on care being provided, that that care is equal to what the care that was expected when those policies were written for nursing home care. Okay. Also know that there's criteria before the benefits will pay out. Some have a waiting period. Some have a waiver of premiums once you start drawing the benefits. Some have a bed hold benefit. So if you are in the Taj Mahal of a facility, you are in the best memory care or you are in the best nursing home and they have a long waiting list and your loved one has to go to the hospital, and because these facilities have these long waiting lists, they're going to tell you, if you're not here and paying for this bed, I'm going to fill it with somebody else. Some of the policies will pay that bed hold for you and some won't. So even though they were paying while your loved one was in the facility, while they're gone in the hospital, they're not going to. And the nursing home or the assisted living or the memory care may give up your bed, their room, because they got somebody that's going to come in and pay. So that's another good question. For those who have a long-term care insurance policy and also have a healthcare savings account, this is something that I didn't know about till not too long ago. Most healthcare savings accounts, so that's where through your employer, you can put so much money every month into this healthcare savings account. It's a pre-tax place to put some of your income, and you can use it for unreimbursed medical expenses. With healthcare savings account, that will not, you can't pay other insurance premiums. The only insurance premium that you can pay out of a healthcare savings account is a long-term care insurance policy premium. So these policies are not cheap, but if you think you want one and your employer has a healthcare savings account, that may be one way for you to put some pre-tax dollars into that healthcare savings account that's going to help you pay that premium for that long-term care policy. Again, I don't sell insurance, but that's something that I found out just recently. So again, can you get a policy that provides good coverage and is affordable? Makes sense. The younger you are when you take out a policy and the healthier you are, your premium is going to be less. But because you are younger, makes sense that you're probably going to be paying that premium for a lot longer time. If you are older, you're going to be paying a higher premium, and some of these policies, the premiums go up as you age. So that's another thing to be looking at. If you already have some significant health issues, you're probably not going to get a long-term care policy that's going to be anything that most of us can afford. So if you've had a heart attack, if you've had a stroke, if you're a smoker and have chronic lung disease, they may quote you a policy, but that premium is going to be through the roof. So realistically, the younger and healthier you are, probably a more ideal time to even look into this. Again, they don't all pay the same amount. That's the other thing that I want to say is when you're looking at a long-term care insurance policy, don't look at something that's going to pay for 100%. You kind of want it as a gap. You know, if you're still going to have some retirement income, you're going to draw some social security. You've got some investments that are going to be paying out a little bit. So you're going to have some good income to help pay for care, but you want to have a little more coverage. So, you know, if I tell you that it costs $200 a day to stay in a facility, you're probably not looking for a long-term care insurance policy that's going to pay $200 a day. You might look for something that pays, you know, $50 to $100 a day. So those are some things to look at. So when's the best time to buy a policy? Wish I had that magic calculation for you, but just know with as you age and the more health issues you have, the harder it's going to be able to afford a long-term care. Also know that they don't all pay out forever. You know, some have a lifetime benefit, but that lifetime benefit doesn't necessarily mean for the rest of your life. It may be a lifetime benefit or, you know, $400,000, whichever comes first. So whenever someone's there trying to say, but it has a lifetime benefit, really understand what lifetime benefit means for that particular policy. Number one, most important thing that I can tell you is buy from an agent you know and trust. No, buy it from the agent that you see in church, that, you know, you play golf with, because they got to look you in the eye. You know, don't buy it off the TV. Don't buy it from some traveling salesperson. Buy it from someone you know and trust. Oh, one thing I forgot to mention on the long-term care insurance. There are some life insurance policies that once you live to a certain age will allow you to use some of the cash value of that life insurance to pay for long-term care without a penalty for, you know, cashing it in. So again, not all life insurances have that built into them, but there are some. So that might be a question. If you or your loved one has a life insurance policy, is to ask the agent. And whenever you are working with any kind of premium, always list a second person to get a notice if there's a lapse in premium payments. And nowadays, a lot of these policies, they say they're going to email them to you. Print it out in hard copy. And if you don't have the ability to do that, insist that you get a hard copy of that. And either you put it in a place that you know where it is, or you give it to someone who's helping you through this process. We've spent a lot of time looking for policies that we can't find, and people have been paying premiums on.
I'm going to jump into here too, right quick, Jackie, and say that that's one thing that they recommend. Give your information of your life insurance policies, your long-term care policies to your PO, your power of attorney. So they know what kind of policy you have, who it's with, and how to get a hold of this. They recommend having a notebook with all your life insurance policies, your investments, your passwords online, everything like that. Have it in a notebook and give it to your power of attorney for financial and your power of attorney for healthcare.
Yep, definitely. And like I said, also, whenever you're taking out any kind of insurance, car insurance, whatever it is, really request that they put a notice to someone other than yourself if there is some lapse of payment. Okay, so what does Medicare pay for? Wouldn't it be great that Medicare paid for everything? Once we got 65, we didn't have to pay for nothing. Well, guess what? That's not what Medicare was intended for in the long-term care arena. So understand, Medicare will pay as long as you meet criteria for skilled home health. That's typically short-term. It's nurses, therapists, and sometimes CNAs to come into the home to help with more acute healthcare needs while you're at home. There are some things that will qualify you for longer episodes of getting help in the home that's paid for by Medicare. The majority of that, though, is typically short-term, following a hospitalization, a surgery, a chronic wound, something like that. So they typically, this is for the nurse to come in and do her thing for that day, as far as change the wound, check the vital signs, listen to the lungs. Therapy is going to come in and work with them, maybe initially every day for a couple of days, and then it's more like 2 to 3 times a week until you meet to where they feel that you can then go for outpatient. Hospice, Medicare does pay for, again, end-of-life care at home or in a facility, but it's not 24-hour care. It is for the care to be the oversight of the care by a registered nurse with a social worker support, bereavement support, but they're not going to be providing 24-hour care in the home. So when we're looking at nursing home, skilled nursing home, again, for Medicare to pay, you have to have a 3-night qualifying stay, and that's 3 full admission days. Remember that now you can be in an observation bed in a hospital for 48 to 72 hours and still not be considered admitted to the hospital. And so those days do not count as your 3 overnight stays. But if you've had 3 overnight stays in a hospital, Medicare can provide coverage up to 100 days in the nursing home. For the first 20 days, as long as you meet the criteria, it's kind of an 80-20 split. After, for day 21 through 100, even if you continue to meet the criteria, your copay would be, for 2021, is $185.50 per day. Now, if you have a Medicare supplement, a Medigap, most of those will pick up that copay, that coinsurance on your behalf. If you don't have it, it's $185.50 out of pocket for those days. Even if you've used up your 100 days, if Medicare does, if you get those 100 days and you're still needing therapy, you're still needing nursing home care, Medicare is not going to pay that daily fee. But if you meet the criteria, they're still going to cover your therapy, your rehab, your speech, your occupational therapy, your physical therapy. That's for people who have original or traditional Medicare. So we see all kinds of commercials about Medicare Advantage plans, and they say low or no premiums are due. That's a game changer. Remember that those Medicare Advantage plans are managed care, and each plan is different. And everything we just talked about Medicare paying for care in the nursing home goes out the window. And I've yet to run into a Medicare Advantage plan that will pay for more care than what original Medicare will pay. They'll tell you what doctors you can go to. You have co-pays for any type of specialized care, and they really, really limit your nursing home care. If you are a healthy individual, Medicare Advantage plan may be the way to go, because a lot of times it offers, some additional dental for you. It throws in your medication coverage for you. But once you start to have health issues, and especially if you need any type of specialized care, please beware of Medicare Advantage plans. We still have physicians in our area that will not see you if you have a Medicare Advantage plan, because The Medicare Advantage plan is going to tell you that your physician is in there, is a provider for the Advantage plan, but they really dictate what the physician can order for you, can prescribe for you. So Medicare Advantage plans really, really need to be looked at under a microscope before you go that route.
Okay, we have a couple questions, Jackie, or statements. Are Medicare Advantage plans written by private companies? Does
Yes.
it fund any Advantage plans? And then
They are written by private insurance plans, and the government, so yes, so the government funnels a certain amount of money into these Advantage plans, and the way the Advantage plans make their money is by limiting your care. Does that make sense? Because they manage your care. So they are private insurance companies who get money from the government to care for you, but these folks want to make money, so they're going to have very strict oversight of the care that you receive.
Okay, and there was another statement too. She says CMS has currently waived the 3-night stay during the pandemic.
For some situations, they are waiving it. It depends. And there is a way to appeal that, which we don't have time to really go into that. But there is some waiving of that 3-night, because hospitals are being, it's to everybody's benefit to keep you in the hospital the least amount of time right now with the pandemic going on. So that is correct. So then we talk about Medicaid. So Medicaid coverage for long-term care. So the thing you have to understand about Medicaid is partially funded by the federal government and partially funded by each state. So every state in our nation has a different Medicaid system. So remember, the criteria is different from state to state. So if you have a family member, living in California, and they're saying, well, mom and dad should be able to qualify for this because blah, 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 blah. Well, that's because that's the way it is in California. It is different in Illinois. So just be aware of that. It assists with the cost of assisted living for supported living facilities. So again, we have limited facilities on the assisted living level that participate in this Medicaid program. But for nursing homes, it does assist with the cost of ongoing long-term care for those with limited income and resources. So again, know the rules. For an individual, assets, they can have assets of $2,000. So if they are an individual and they don't have a spouse at home, they can have $2,000. Their income they'll get to keep a limited amount every month, $30 a month for their personal spending. Otherwise, income will go towards the cost of their care. So they have to have spent down their assets so that they have no more than $2,000. And then Medicaid is going to come and pick up the cost of their care. If they have a home, if they lived alone and they have a home and they have some property, there's like a 6-month intent, that you're going to be able to go home within 6 months. So they're not going to put a lien on your house or anything like that for at least 6 months. But if we are talking long-term stay in a nursing home, they're going to expect you to, spend down your assets before they're going to pick up care. If there's a spouse at home, the spouse at home is allowed to keep a fair amount of assets and income. They're allowed to keep their home, their vehicle, and $109,560 in assets, and the spouse at home is eligible to keep $2,739 in monthly income. So if their own income is less than that, they can make up the difference from their spouse's income before, and then the remaining of the spouse's income will go towards the cost of the nursing home care. Beware of transfer penalties and look back penalties. So if I have $500,000, in assets, and I want to transfer them to my kids, know that Medicaid is going to look at any assets transferred in the past 60 months. And there's going to be penalties for that, and Medicaid's not going to come and pick up the cost. There's a lot of caveats and a lot of details in this particular plan for Medicaid. So you really need to seek assistance from attorneys and financial planners who are knowledgeable with the Illinois Medicaid process, so that you don't get stuck with penalties and that look back period. Okay. So again, this next slide just goes again, that shows you what the spouse at home can still have. The change this year is the equity of the house. So the house has to be worth less than $603,000. There were people who said, I have a spouse at home and I don't want all my money going to the nursing home, so I'm going to buy a mansion for them to live in. And they did. And because more and more people were doing that, and then they were saying, and then once I die or whatever, my spouse or my kids can sell this, $2 million house and then have my assets. So I don't know too many people personally that were able to do that, but that's the kind of thing that happens. So Illinois has put the limit on what the house and adjoining properties can be worth. That's new for 2021. Okay. When a person is looking at spending down their assets, there are also some assets that are allowable things that they can spend their assets down on, such as funeral plans, updating any type of medical equipment that they need, such as wheelchairs or things like that, special shoes, special clothing, new dentures, new eyeglasses, things like that, out-of-pocket costs that are necessary in their care, that allows them to spend down some of those assets. So again, that's where talking with someone that really knows Medicaid planning can help you determine how can I still, what can I do to protect some of these assets so that I then have them to spend on the quality of life issues that my loved one's not going to be able to have once they have to rely on Medicaid for paying for things. Another positive COVID caveat is stimulus money. Stimulus checks do not count as income and therefore do not impact Medicaid applications. So, however, that stimulus money has to be spent appropriately within 12 months. Otherwise, it then is counted as an asset. So it could impact the year ahead if they don't spend it. But as of right now, stimulus checks do not count as your income and asset. So who can help you as far as getting even a few more details or the actual application process? This is our region's family community resource, and it is in Charleston. Of course, they're going to recommend that you do as much as possible online. Boy, that's hard, because you are going to have to come up with 5 years, that's 60 months. They're going to look at your bank statements and they're going to peruse them with a fine-tooth comb. So back when we're talking about paying for people privately and not keeping good records, they're going to audit you. So if you're writing out a check to Jane Murphy every week for $500, and you say, well, that was, I spent that because they were caring for me in home. If you don't have clock in and clock out hours, if you don't have at least a journal of the different things that they helped you with, they can consider that a gift, and it can be held against you for Medicaid purposes. So there are some things that can be done to protect some assets from Medicaid, but you really got to know what you're doing, or it can really cause a lot of issues. Again, veterans benefits, limited, but they are available, and we have been able to tap into something called the aid and attendance pension. I've got the amounts listed there. These are for our older veterans and their spouses. So, we are talking, I don't think we have any World War I veterans left anymore. We still have some World War II. We've got the Korean conflict. With Vietnam, they had to be active in the Viet Cong area. For our World War veterans and our Korean veterans, they didn't actually have to be in combat. They had to have served during a wartime period. Okay, so they didn't actually have to be in combat, and they have to be discharged honorably. So they had to have 90 days of continuous service with at least one of those days during an eligible wartime period, but they did not actually have, so they could have been stateside, but the conflict was going on. They must require regular attendance or assistance in at least 2 activities of daily living. There is an income and asset limit, and I'd love to be able to tell you what that is, just like for Medicaid, but the VA has its own little way of figuring that out, and they won't really let us know. They don't give us those raw numbers. But it's based on your life expectancy and the amount of assets and income that they say you can have. But there is considerable amount of money, as I've got listed there, that for people who qualify can help. So those are monthly pension rates there that I've got listed. And if you apply, doesn't mean you're going to get the maximum amount for any of those categories that I have there. My very first person that I hooked up with this VA aid and attendance pension was a little lady in Casey, Illinois, and we got her qualified for $50 a month based on her deceased spouse's service record. And you think, well, $50, was it even worth that? Well, that paid a lot of her groceries every month. And then once she moved into a facility and her costs, qualifying costs went up, she got the maximum amount for a surviving spouse. This is a very detailed, lots of paperwork application. No one can charge you for assisting you with applying for this. Your local veterans officers are supposed to help you with this. They don't like to, and I really respect all of them because it is a lot of work, and not everyone qualifies. But if you are a surviving spouse, if you are the surviving spouse, if you are the veteran that qualifies during those war periods, if you have a parent or a sibling, it is their right. And so you kind of have to be the squeaky wheel. Okay. Now, this is a group that I just had the privilege of working with this past year, and I've had a couple of families that they've called and asked me to work with. And it is called the Senior Living Foundation Parent Program. This is not a government agency. It is funded solely through donations, but they provide support for active duty foreign service personnel who are managing their parents or their parents-in-law, their health needs from afar through this program that is called the Foreign Service Parent Program. It is limited, but it is helpful with planning and program linkage. So what they contacted me to do was to go into their homes and see what kind of needs, what things did they really need help with. So based on the amount of donations that they have to divvy out, I was able to get things like a new refrigerator. Through the through the big shutdown period, I was able to get home delivered meals, not through the local Meals on Wheels, and I'm not dissing them because, oh my gosh, we love our Meals on Wheels, but through a program called Meals from Mom. I had a really picky older gentleman, and his wife is like, we've tried Meals on Wheels and he just won't eat them, and I'm not wasteful, so I don't want you to send those. And so I said, well, let's try this Meals from Mom program. They got 3 meals a day for 4 months, and he ate more of them than she did. So their son was stationed in Guatemala through this, and so that's how they qualified. I did things like just hook them up with an attorney to update their powers of attorney and their estate planning. So again, they do have some financial assistance on a short-term basis to cover some facility care, reimbursement care. Was able to get new dentures paid for an individual through this organization. So again, limited, and funds they have today, they may not have tomorrow, but if you know anyone or you have a family member, again, who is active military and they are no longer, they're serving somewhere other than stateside, this might be something else that you can tap into for them. Also, when we talk about the regular VA, remember the VA can help with a lot of things. They can provide respite care. They can, again, provide the emergency response buttons. They can provide ramps, wheelchair ramps. So let's not forget about tapping into our veterans services. This is an average cost of care in Illinois. Genworth, this was 2020. Genworth puts this report out every year. So they've got Illinois by regions. You can see I've got it listed here for assisted living, nursing home. We've got semi-private, which is 1 person, 2 people in a room, and a private room. So Springfield, Champaign, Decatur, and Carbondale are the, then there's a couple areas up in Chicago, so I didn't include those on here. But you can see just the difference in the different areas, and none of those areas are really too far from us. So then I did my own calling around, and this is one of the spreadsheets I can get out to you. So I have everything in Effingham. I also included Lutheran Care, in Altamont and Heartland Senior Living there in Neoga for the nursing home costs. Home care, if you go through an agency in our area, you're going to pay $18 to $25 an hour, and some of them have minimum hours per day that they will, send a caregiver in. If you have them, some of the agencies will give you discounts if you are having 24/7 care in the home. Assisted livings, these are their base rates. Anywhere from $2,800 to $3,198 per month. Those are the base rates. Some of them have level of care fees. So depending on just exactly what all they're doing for you, those costs go up. Memory care, this is for the 2 memory cares here in Effingham. That would be Lavender Ridge and Willowbrook. Those are their private rooms. The nursing homes, that's what I have. That's an average for here in Effingham. I also include Lutheran Care and Heartland and Neoga. It's an average of $167 a day. And then, oops, that should say 167 instead of 161 times 31 days for that monthly rate. So that kind of gives you an idea of how we compare here. Now this is help at home. This came from Genworth, and this is through agency, and this is based only on 44 hours of care per week. So that's what you're looking at, and that's not even 24-hour care if you're looking at care in your home by a licensed agency. So you can see how that really, really can add up quickly. So Shannon and I have both alluded to this importance of having your advanced directives in place, your healthcare power of attorney, who is going to make decisions for you when you can no longer make them for yourself. This is a document. It does not have to be done by an attorney. You can go online through the Illinois Department of Public Health and print this form off. In Illinois, 1 decision maker at a time for your healthcare issues. We as nurses and doctors don't want to have 2 people named and have them both arguing about what's going on. We need a go-to person. You can list in succession who, if the first person is not willing, able, or available, who's going to go next, and then next, and then next, but 1 decision maker at a time. You get to decide who that is. Once you decide who that is, please share your wishes with your decision maker. Do not put them in a situation that they have to make a decision for you and they have no idea what your wishes are. Okay. Also, give them a copy of it. You should keep a copy in a safe place. They should have a copy in a safe place. Your doctor, your primary care physician, the hospital will ask you and they'll scan it in. So if you ever update it, make sure that everybody has the most recent one. And they should be updated with life events, deaths, marriages, divorces, any of those things, births, and that's for you. That's for the decision maker. Maybe they've, not turned out to make real good decisions for themselves. Is that someone that you want making decisions for you? So, again, I think that your healthcare power of attorney is the most important legal document that you can have. Okay. So I know we've covered a lot. I know I did not give you an easy button or a magic potion, but I hope we've given you some things to think about, to start making a plan. I hope you have this really good plan and you never need it. That would be awesome, but you need to have a place to start. And this hopefully will give you some resources. Again, I can put all these websites and telephone numbers into a document and that can be emailed out to you. I will also this spreadsheet that I did. You probably can't see it very well, but it's got all the facilities with their addresses, phone numbers, monthly rates, and those that do on it on a daily rate, those are on there. So all those little things are on there. So that's a good resource for you.